Hi there, I'm Charlotte Murray from Back to Fitness Physio, and I would like to introduce to you our new K-Laser Cube 3. We're the only physiotherapy clinic in Calderdale and Huddersfield that offers this service. In fact, you probably have to drive about 40 miles to find another physio clinic offering it. It's not offered in the NHS, and even the private hospitals locally don't have one. It's very much a treatment which has been enjoyed by the likes of the professional sports teams and athletes, because they recognise that treatment with K-Laser gets people better quicker. Laser therapy itself has been around since the 1960s, but K-Laser is the only NICE approved laser on the market. There are others, but K-Laser is the most powerful, which means that we can treat structures which are deeper, more effectively and in less time. It's more commonly used in veterinary medicine. It's used in podiatry for things like fungal nail infections and verruca removals. It's used in dentistry to aid the healing of the bone onto things like dental implants. And it's also used in wound management for things like diabetic ulcers. It's really amazing, and I'm so pleased to be ahead of the physiotherapy curve, offering the latest in laser technology to our patients. So what is it? So we're using select wavelengths of light which sit in the visible red and infrared spectrum to stimulate key molecules in our tissues. This increases the cell's metabolism, which means that the cells heal quicker and better. The idea of light influencing tissue to reduce pain and speed up healing might seem a bit far-fetched. It certainly did to me before I sort of read into it. But we can all appreciate that if we go out in the sun on a summer's day, the melanin in our skin reacts with sunlight and we get a suntan. Also, we absorb vitamin D from the sun through our skin. If we absorb too much UVA and UVB rays from the sun, then it damages the DNA in our skin cells, which can cause genetic mutations leading to cancer or premature aging of the skin. It goes without saying that there are none other harmful wavelengths in the K-laser treatment. So that's the principle. The K-laser uses certain wavelengths of light which cause positive changes in cells. As a result, skin, tendons, bones, ligaments and muscles are repaired faster with reduced inflammation, scarring and pain. Who can it help? Most people. Generally speaking, if you can go out in the sunlight, you can have K-laser therapy. It's a pleasant treatment, it just feels nice and warm, nothing awful about it at all. As the main benefits are pain relief and accelerated healing, if you're the coach of a sports team who has players out with injury, or if you're a runner with an event coming up and injuries jeopardising it, then laser therapy is the best way to get you back to fitness quicker. What can it treat? Well, pretty much everything. It doesn't matter if the injury is new or old, superficial or deep, or from the top of your head to the tip of your toes, K-laser can help. So things like soft tissue injuries to muscles, ligaments, tendons, arthritis, back pain, sciatica, frozen shoulders, sports injuries, carpal tunnel syndrome, trigger finger, plantar fasciitis, nerve pain, honestly, everything. We're also using it really successfully following surgery. The laser promotes healing of the bone, cartilage and muscle, but also the appearance of the scar. So scars that are treated with K-laser, they're less raised and bumpy and they heal and look better. Next thing, how often should you have it? Well, as amazing as it is, it's not a silver bullet and a course of treatment is usually required. Treatments are usually spaced at 2 per week for the first few weeks and then go to once a week or fortnight until patients are fully recovered. I would say most people need 6 to 10 sessions in total. Some people then go on to have top-ups every month or so, as it can provide a non-surgical and non-drug way to manage long-term problems like osteoarthritis. Laser treatment doesn't take long, typically about 15 minutes, and it will form part of a normal 30-minute treatment session. So we still do all the usual physio, hands-on treatment, rehab, exercises during the sessions. It doesn't replace them, it enhances them. So we will continue to work on your biomechanics and movement patterns, and the laser will work on your cells. Most people feel substantial pain relief immediately following their first treatment. It's amazing. Occasionally they don't, but it doesn't mean it's not working. It just means that the benefits are cumulative, and typically by the 3rd or 4th session, patients are feeling much better. The big question, how much does it cost? Well, laser treatments are more expensive than our normal rate because you get everything that we normally do plus the benefits of the K-laser. I honestly think that it's the best thing that we have to get you back to fitness quickly and better. There is more upfront cost, as appointments need to be condensed initially with 2 a week, but the full recovery should happen quicker, meaning that the course of treatment finishes sooner. There will be cellular healing, and because we will have addressed all the biomechanical, postural and strength issues, the likelihood of the injury coming back will be much lower. You can choose to pay as you go or opt to purchase discounted packages of 6 or 10 sessions. I've been qualified for over 20 years now, and I've seen many machines come and go over this time. We have a shockwave machine and I really rate it. For chronic tendon problems, it's amazing. But for everything else, the laser is now my go-to. I've nothing else at my disposal which can provide such immediate pain relief. I'm a total convert, and for me, it's been practice altering. I absolutely love it.